Our today's topic is pneumonia. Pneumonia is an infection that inflames the air sac in one or both lungs. The air sac may fill with the fluid or pus, causing cough with phlegm, pus, fever, chill, difficulty in breathing. A variety of organisms, including bacteria, viruses, fungi, can cause pneumonia. Pneumonia is inflammation of lung parenchyma. It happens when the infection causes the air sac in the lungs to fill with fluid or pus that can make it hard to breathe enough oxygen to reach the bloodstream. It is an acute inflammatory condition basically of lungs parenchyma caused by bacteria, virus, fungi, and some non infective agents leading to impaired gas exchange and consolidation, that is fluid filling instead of gas. It can be caused due to the community, or it can be community acquired outside the hospital due to various microorganisms like streptococcus pneumoniae, mycoplasmas, and viruses. It can be hospital acquired. It can be due to the attack of various microorganisms after admitted to hospital. It can be ventilator acquired. It is acquired from the ventilator and due to the unsterilized instrument on the ventilator. It can be aspiration pneumonia. It is due to the inhalation of aerobic, anaerobic, and other microorganisms through mouth. Next is etiology and risk factors of pneumonia. Many germs can cause pneumonia. The most common are bacteria, virus, fungi. In air we breathe, body usually prevent these germs from infecting the lungs. But sometimes these germs can overpower the immune system, even if the health is generally good. Then first cause for the pneumonia is bacteria. The most common bacteria that cause pneumonia is streptococcus pneumoniae, mycoplasma pneumoniae. It may affect one part of the lung. A condition is called as lobar pneumonia. Second is the virus. Respiratory syncytial virus is RSV. Influenza type A virus, B virus known as flu viruses, including COVID-19, can cause pneumonia. Viruses are the most common cause of pneumonia in the children younger than 5 years. Viral pneumonia is usually mild, but in some cases it can become very serious. Coronavirus 2019 may cause pneumonia which can become severe. Third is fungi. Cocci fungus cause pneumonia, coccidioides. This type of pneumonia is most common in the people with chronic health problems, weakened immune system. Fungi that can cause it can be found in soil, bird droppings, and various depending upon the geographical locations. Various fungi are Aspergillus, Cryptococcus, Neoformans. These are the various fungi that can cause pneumonia. Various risk factors are there like cigarette smoking, upper respiratory tract infections, alcohol, corticosteroid therapy, old age, recent influenza infection, other lungs infections, weakened and suppressed immune system. Next is clinical manifestation and diagnosis. First symptom is fever and chill, productive cough with sputum. Sputum is basically yellowish and greenish in color. Chest pain when you breathe or cough. Dyspnea, respiratory rate is less than 20 per minute. Next is tachycardia. In this, heart rate becomes less than 100 beats per minute. Breathing sound is there. Dullness to percussion. Pleural effusion, that is lungs filled with the fluid. headache, exhaustion, vomiting, loss of appetite, excessive fatigue, blueness of skin, nausea, joint pain, muscle ache. Older person have change in their mental awareness. Newborn might vomit, have fever, cough, tiredness, and in some cases it causes severe illness or even death also. Next is pathophysiology. Firstly, we will do the diagnosis of pneumonia. First is the X-ray. This helps the doctor to diagnose pneumonia and determine the extent and location of the infection. It can't tell what kind of germs is causing the pneumonia. Obviously, X-ray don't tell the what kind of microorganism or virus is this. Second is HRCT, that is high resolution computed tomography, to scan the chest whether there is a fluid filled or what type of infection is there. Third is CBC count. It is a complete blood count test. Blood tests are used to confirm an infection, to try to identify the type of organism causing the infection. Precise identification is not always possible due to there is some differentiation in different blood cultures. Next is a sputum test. A sample of fluid from the lungs is taken after a deep cough and analyzed to help pinpoint the cause of the infection. Next is the blood culture. Blood culture ABG is also used for the arterial blood gas test, that how much oxygen is there in the blood, how much is the carbon dioxide, what is the pH. An arterial blood gas test is to measure the oxygen in small amount of the blood taken from your arteries. Next is CT scan. If your pneumonia is not clearing as quickly as expected, your doctor may recommend the CT scan to obtain more detailed image of your lungs. Pulse oximetry is also a test to check the oxygen level in the blood. These type of tests are used to diagnose the pneumonia. Next is pathophysiology. Pathophysiology is very easy, as you all know that lungs infection or pneumonia is due to the fluid filled in the lungs. It is given in the flow chart that infection of the lung is due to its causes bacteria, viruses and fungi. Due to these viruses, there is an inflammatory response inside the lung sacs, air sacs, alveolar edema or exudate formulation. Alveoli are swelled up, or swelling is there in the alveoli, and exudate formation, fluid is formed in the alveoli. Alveoli respiratory bronchioles filled with the serous exudate blood cells, fibrin, bacteria. There is a pus or fluid filled into the alveoli and respiratory bronchioles or air sacs. Consolidation of lung tissue. Consolidation means lungs are compressed, or there is a less air sacs are there where there is oxygen or air exchange takes place. A pulmonary consolidation is a region lungs tissue that has filled with liquid, a condition marked by induration, that is swelling or hardening of normally soft tissues. Of normally aerated lungs, air sacs are swallowed and fill with the fluid. Next is non-pharmacological treatment. First is oxygen therapy. It is given through the nasal cannula. You can adjust the flow. If there is severe hypoxia, you can increase the flow of the oxygen. Chest physiotherapy, spirometry is there. Postural drainage of sputum is there. Active cycle of breathing technique for bedridden patient is there. Rest and positioning. Bed rest advised to in the acute stage. It improves the lungs expansion and improve the flow of the oxygen or exchange of the gases. Mechanical ventilator, it is used for the severe respiratory infections or failure. Hydration and nutrition is there. Adequate fluid intake, if it decreases the risk of dehydration. If you can hydrate yourself, there is a less risk of dehydration. High protein diet should be taken to support the immune system to prevent the diseases. Preventive measures are there. Pneumococcal vaccine and influenza vaccine should be used. Stop smoking. Good personal hygiene can prevent the individual from respiratory tract infections. Next is pharmacological treatment. Beta-lactam antibiotics, they inhibit the cell wall synthesis, beta cell wall synthesis in the microorganism. Examples are amoxicillin, ampicillin, cifatriaxone. Macrolides हैं, cover the mycoplasma and decrease the protein synthesis in the microorganism. Azithromycin, erythromycin are the examples. Respiratory fluoroquinolones हैं, inhibit the DNA gyrase and cover the Streptococcus pneumoniae and render them harmless. Levofloxacin, moxifloxacin are the examples. Other than these type of drugs, you can take the antiviral agents in case of viral infection. Bronchodilator, if there is a bronchioles are filled with fluid, then you can take the bronchodilators to dilate the bronchioles. Examples are salbutamol. It can decrease the airway resistance or dilate the bronchioles. Cough suppressants are there. Dextromethorphan suppress the cough. Fever, to reduce the fever reducer or pain reliever like aspirin, ibuprofen, acetaminophen you can use. Thank you.